Thanks for taking the time to watch this presentation regarding changes to your health and prescription drug benefits. The changes explained in this presentation go into effect on October 3, 2011. Your Benefit Trust Fund is working to provide you with comprehensive health care benefits, but it's becoming harder and harder for us to afford our current programs. In 2011, your Benefit Trust Fund will pay an estimated $11,100 per enrolled participant for these benefits. In 5 years, that could increase to $18,000. And in 10 years, that could increase to over $28,000 per participant. We simply can't sustain these cost increases. Medical and prescription drug claims are the primary drivers of your plan costs. And when claims costs go up, the contributions negotiated to provide your health benefits must go up too. This can affect the dollars available for your wages and retirement. As you think about health care costs, it's important to understand that in most plans, around 20% of members are responsible for 80% of the plan's costs. And perhaps more important, over half of these members did not have large claims in the previous year. Studies also show that members' lifestyle choices, for example, if they smoke, are overweight, or don't get regular physical activity, are responsible for 70% of the plan's costs. So we believe if we can help our participants understand their health and help them take action on their health risks, we can reduce our costs over time. Your Benefit Trust Fund, working with your union and employer, is taking action through an initiative called Healthy Together. We will need your help too. Healthy Together focuses on 2 areas. First, we want participants to live the healthiest lives possible. Second, we want you to make smart, informed choices when you use your benefits. Doing these things will keep money in your wallet with no sacrifice to the quality of your care. It will also help your Benefit Trust Fund to save money over time. The bottom line is we are in this together. Before we talk about the changes going into effect in October, we want to remind you about how you pay for your health benefits. First, your employer's contributions are the primary source for paying your premiums for health coverage and your health claims. The contributions you make from your paychecks are also used. Second, as you need health care during a given year, you first have to meet your annual deductible before the plan pays any benefits. Third, you may pay co-payments when you get your prescription drugs. Your co-pays do not count towards satisfying your annual deductible. Fourth, you pay co-insurance for many services under our plan like MRIs or CT scans, outpatient surgery, and hospital stays. Co-insurance is a percentage of the cost for a service shared by you and your Benefit Trust Fund. Fifth, you should know about your annual out-of-pocket maximum. This limits how much co-insurance you pay in a given year, and once you hit the maximum, the plan pays 100% for allowed charges. Your co-payments and the amount you pay for your annual deductible do not count toward this maximum. So here is what is changing as of October 3, 2011. You will need to talk with a care counselor before you receive non-emergency care from anyone other than your primary doctor. Second, if you need routine total hip replacement or total knee replacement surgery, you will save money if you work with an Anthem Blue Cross designated hospital. And third, you will need to use the lowest cost prescription drugs whenever appropriate. If you take the time to understand why these changes are necessary and what you need to do, you will save money without sacrificing any quality in your care. Let's start with the rationale for our care counseling program. You probably already understand that you pay less money out of your pocket when you use an Anthem Blue Cross network provider. But did you know that the cost for the same service might be very different among those providers? Because you pay co-insurance for many services, this fact can cost you hundreds and even thousands of dollars. And that's where our care counseling program comes in. The program is designed in part to help you find quality, cost-effective providers. Here is an example. We used the Anthem Blue Cross online care comparison tool to find a local provider for an MRI of the spine. We were surprised by the results. The cost for the same service ranged from over $872 to over $4,000 for the exact same service offered by network providers. This can have a huge effect on your wallet because you pay coinsurance for this service. When you choose the lower cost provider, you'd pay around $175 out of your pocket. And for the higher cost provider, you'd pay over $800 out of your pocket, again for the exact same service. So it's important to understand that you have a choice. You don't have to go where your doctor sends you. You can do a bit of research and save yourself and your benefit trust fund money in claims costs. This is where our new care counseling service comes in. Our care counseling service can help you find a primary doctor who coordinates your care, can help you find the most affordable Anthem Blue Cross Network provider, can help you understand a medical condition or diagnosis, can help you with self-care, and can work with you or your doctor to make sure you receive the appropriate level of care. This service is provided by a specialty health company based in Northern California called Pacific Health Alliance. You can call our care counseling service at any time for any reason, and you'll need to call the service before you get non-emergency treatment outside of your primary doctor's office, for example, before you see a specialist, and before you receive tests and procedures at a hospital or outpatient facility. You can talk with your care counselor about the different Anthem Blue Cross Network providers who offer the services you need and their costs. You can still visit any provider, but we believe most participants will choose a lower cost option if they know about it. A nurse line is also available 24 hours a day, 7 days a week. And through the nurse line, you can connect with a registered nurse to talk about your questions about your health and also talk about your doctor's recommended treatment for your injury or illness and what to expect as you proceed with treatment. You can call 1-855-754-7271 toll-free to reach a care counselor. This number will also be included on your benefit plan ID card. Representatives are available on Monday through Thursday from 7 a.m. to 7 p.m. and on Friday from 7 a.m. to 5 p.m. Pacific Time. If you call after hours, you'll connect directly with a registered nurse. And please know that your conversations with a care counselor are completely confidential. Now we'll talk about the rationale for our second program change. As we just discussed, the cost for the same health service can vary greatly among providers in the Anthem Blue Cross network. This applies to surgeries and hospital care as well. Yet there may be little evidence of a higher quality of care at a higher cost facility. And this fact can cost you and your benefit trust fund thousands of dollars. So your benefit trust fund is putting in place a new benefit design for routine total knee or total hip replacement surgery. We are working with a group of hospitals within the Anthem Blue Cross network who have agreed to charge no more than $30,000 for these surgeries, and this will become the maximum charge allowed for these surgeries. There are over 40 hospitals in the Anthem Blue Cross designated hospital network, including UCSF Medical Center, Good Samaritan in San Jose, and Community Hospital of the Monterey Peninsula. And if you decide not to use one of the designated hospitals in the Anthem Blue Cross network for these surgeries, you will be responsible for any amount over the $30,000 maximum. If you need to travel more than 50 miles from your home to a designated hospital, you may request reimbursement of up to $750 for your travel expenses, and this reimbursement may be considered taxable income by the IRS. Here is an example for routine total knee replacement surgery. This example applies to participants in Plan 2. First, you can see how the hospital charges might vary based on whether you decide to get your surgery through a designated hospital, at an Anthem Blue Cross network hospital, or through an out-of-network hospital. The designated hospitals in the network agree to charge no more than $30,000 for these surgeries. However, other hospitals may charge much more. In any scenario, you pay your share of coinsurance until you meet your annual out-of-pocket maximum. Then your benefit trust fund pays the balance up to the $30,000 maximum charge. At a designated hospital, you won't see any additional costs. However, at a regular network hospital or out-of-network hospital, you're responsible for your coinsurance plus any amount over the $30,000 maximum. So it will be very important for you to consider visiting a designated hospital if you need routine total knee or total hip replacement surgery. Here is a list of the Anthem Blue Cross designated hospitals participating in this program. Be sure to call our Care Counseling Service if you are planning routine total knee or total hip replacement surgery. They will confirm you are scheduled at a designated hospital and work with you to pre-authorize your surgery with Anthem Blue Cross. Also, you can request the most up-to-date copy of the designated hospital list from the Trust Fund Office. Now, we'll turn the conversation to prescription drugs. You probably know that the cost for prescription drugs can vary greatly depending on whether you use a generic or a brand medication. Here's an example for drugs that lower cholesterol. On average, a 20 milligram prescription of the brand drug Lipitor costs $170 for a month's supply. However, the generic drug Simvastatin costs just $15. The bottom line is, if participants use the lowest cost medication whenever possible, we can all save money, and we'll show you how. A generic drug is a copy of a brand name drug. Its active ingredients are identical. To get approval from the Food and Drug Administration, a generic drug maker must prove its medicine is equal to the brand name product in safety, effectiveness, quality, and performance. Not every brand name drug has a specific corresponding generic drug. However, there can be several generic drugs available to treat a condition or illness as effectively as the brand medications you may be taking now. And a generic drug typically costs a lot less. Starting in October, your Benefit Trust Fund will introduce a new list of covered drugs. The covered drug list is known as a formulary list. The new formulary list will include the most cost-effective drugs for treating various classes of conditions and illnesses. For example, drugs to lower cholesterol, drugs to treat allergies, and drugs for diabetes. The list will include mostly generic medications. You pay a $4 copay when you use a drug that is on the formulary list, and you'll pay the full cost for a drug that is not on the formulary list. And if you need specialty drugs, for example, if you are facing cancer or another complicated illness, you will continue to use the Prescription Solutions Specialty Pharmacy Service and pay a $150 copay for those drugs. If you are taking medications that are no longer on the formulary list, talk with your doctor right away. Ask if there are alternative medications available to treat your illness or condition. If appropriate, ask your doctor if you can try an alternative. However, if your doctor has determined that your non-formulary drug is medically necessary, he or she can request an exception. When approved, you pay the $4 copay for your drug. You or your doctor can call Prescription Solutions at 1-800-711-4555 to start this process. We encourage you to use the Prescription Solutions website, www.prescriptionsolutions.com. You can register to set up a personalized account and manage your prescriptions online, learn more about your medications, and compare the differences in generic versus brand name drug costs. You'll also find the formulary list online, which you can share with your doctor to help ensure that you pay the lowest cost possible for prescription drugs. You might also take a look at the Consumer Reports website to learn more about the differences between generic and brand name drugs. Go to the Health section of www.consumerreports.org and click the link to the Prescription Drugs section. You'll find unbiased comparisons of generic versus brand name drugs. You can also compare the average cost for drugs and get information about the different drugs that may be effective for treating your condition or illness. So that wraps up our discussion of what's changing as of October 3rd. If you have questions, please call the Trust Fund office at 1-831-757-5265. You can reach a representative Monday through Thursday from 7 a.m. to 5 p.m. or on Friday from 7 a.m. to 3:30 p.m. Pacific Time. We also hope you will take a look at the Fund's new website. You'll find information about your health and prescription drug benefits, about how your Benefit Trust Fund works, and links to program resources. Thanks again for taking the time to review this presentation.